And people say, well, why? How did we get in this situation? There is a Harvard report, Captured Agency, how the Federal Communications Commission is dominated by the industries it presumably regulates, which is a key piece of the puzzle. They talk about how Norm Elster, the investigative reporter, talks about how there is so much money going to Congress. The Federal Communications Commission has former lawyers, industry insiders, former head lobbyists, and they are using big tobacco tactics. Everyone asks, what is the standard that we have in the United States? We have limits that were set in 1996. They're based on short-term heating effects, not long-term effects. Science from the 70s and 80s underpins it, small animal science actually, those limits that we have right now. They've remained largely unchanged, and they don't look at the relevant characteristics of exposure that are relevant to understanding how it might impact us. So, for example, modulation, polarization, data rate, and there are many other characteristics of the exposure are important when understanding how we would be affected. In addition, the person who is affected. So, for example, children are more vulnerable. And this has been published in terms of how they are more exposed, more of their bodies exposed, their brains, their eyes absorb more of this radiation. In addition, they have developing brains, and small impacts can have large effects later, as you know. They have developing eyes, and all of this is not included in the limits that we have. So that's why we are actually part of a historic legal appeal against the FCC with Consumers for Safer Cell Phones, Children's Health Defense, and several petitioners in the case. We are arguing that the FCC made a decision not to update the limits for cell towers, cell phones, for wireless radiation, and we are arguing that they haven't adequately reviewed the record, because on the record of the FCC is thousands and thousands of pages of published science, people documenting how they've been harmed, and more. And the FCC just pretty much ignored it, especially with 5G. They need to be taking the time to set limits that are protective, and we are hoping that they will ask the EPA and relevant agencies to do so. We had oral arguments January 25th, and it went better than could be expected.
Note that the exposure from each portable or mobile device near a person will generally involve low total power absorption while being highly localized, and will not result in significant contributions to whole body average.
And what are you citing for that conclusion? I don't see any authority cited or any study or any explanation of how you came to that conclusion, other than that just conclusory statement. The footnote.
You're correct.
So
well, you're correct. How did we decide that the localized exposure would be absorbed in our
multiple localized exposures for prolonged periods of time?
How that would not be harmful?
Yeah, how did you just say that?
Well, again, I think you have to link the observations here with the observations we made in concluding the notice of inquiry. You're correct. There is no footnote here, but if you go back to the resolution terminating the notice of inquiry, we said repeatedly that there was no evidence of any effect, not just cancer, any illness from radio frequency emissions below our existing levels. And in fact, we said below, at, and sometimes even above our existing
And that
levels.
one said, sorry, can you point me to that paragraph where it was addressing cumulative impacts?
Again, I apologize if I'm not being responsive to your question, but the cumulative effects are addressed here in addition to 1.1307.
And you're referring back to findings that were not themselves cumulative.
No, the scientific conclusions here are cumulative. The scientific studies that the FDA and others have looked at, and
no, the FDA didn't. The FDA was only talking about cell phones. That's my point. That's what there could well be. It's a very big record, and you know better than me. There could very well be something where it was clear that you were relying on either your own determinations rather than just conclusions, or there's another FDA somewhere else, or another agency talked about cumulative exposures from multiple devices over a prolonged period of time for physical impacts other than cancer. And is that, you're telling me that was made at the beginning, cumulative?
I don't know that we used the word cumulative in terminating the notice of inquiry.
Judge Robert L. Wilkins actually said, I'm going to be very upfront with why I'm inclined to rule against you.
It was reasonable for us to rely on
Can I explain my problem? I'm just going to be very upfront with why I am inclined to rule against you. So I want you to tell me why I shouldn't have the concern that I do.
And he asks, why didn't the FDA actually request information from the committees that they have that have expertise in this area?
You said that.
And you say that Congress directed the FDA to establish an electronic product radiation control program designed to protect the public health and safety from electronic product radiation. The statute that you cite there is section, it's 21 USC section 360 II. When I read that, it says that basically the way that is done is that a committee that is established in a cross-reference to 360 KK will be established that will review these standards for testing and emissions level. Okay? But you don't reference that committee anywhere, and I don't see anything about that committee mentioned in the administrative record.
And he asked questions about the interagency work group for radio frequency radiation that the United States actually, we know, used to have, but as far as we know right now, has not met in 2 years.
Then later on in your brief at page 37, you say not to worry because the FCC stands ready to consider changing exposure limits in appropriate circumstances. And you refer to a radio frequency interagency working group that maintains a continuing dialogue between the FCC and the FDA about these issues. And that's referred to in a letter. Or you say that it's referred to in a letter. But when I read that letter, I don't see any mention of that working group. And I don't see anything in the record that says that working group actually exists or looked at any of the evidence in this case. So the problem that I have is that you say that you're relying on the expertise of the FDA, but the entity that Congress specifically said to review this committee, you've given us no evidence that this committee has looked at any of this. And then you say that in the future, to the extent anything needs to be looked at, it's going to be looked at by this working group. But I don't see any evidence that the working group looked at anything this time. So why shouldn't I send it back for the relevant working groups and the FDA to look at this record?
Now, this questioning to the FCC took place in the second half of the oral arguments. FCC counsel Ashley Boisel stated that there is a scientific consensus. They referred to other expert organizations and bodies, citing the World Health Organization and the International Commission on Non-Ionizing Radiation Protection.
So as I said, the FDA said in its letter at JA 8187 that it was engaged in an ongoing review of the evidence in this area. And then, as you say, it represented a specific conclusion with respect to the National Toxicology Program's research on cell phones. But that was coupled with representations in our termination of the notice of inquiry at JA 12 that the World Health Organization had found no substantiated adverse effects from fixed facilities. So this wasn't an inquiry that was limited narrowly.
You are way more expert than me. Is an iPad a fixed facility?
No, an iPad is not a fixed facility.
Is a watch a fixed facility? No.
Right.
Okay. Is a wireless laptop a fixed facility?
No, but
when the notice of inquiry talked about the ubiquitous use of devices, was it talking about fixed facilities?
No, not exclusively,
Okay.
but I was going
No,
to
no,
get
no,
to
but
that.
I don't think that was, okay, I get that, but I just.
I apologize for
The
not
fixed
being
facility
responsive.
stuff, to me at least, doesn't feel responsive unless I'm misunderstanding it. I'm really curious about all these other devices.
What I'm doing is referring to our explanation of why the existing limits continue to be sufficient. And what we said in terminating the notice of inquiry is that the scientific evidence, and we relied on the FDA, but we also referred to other expert organizations and bodies, that the scientific consensus had not changed. And I think it's a mistake to characterize what we did as relying exclusively on the FDA's conclusions, because that's not what we did here. We also looked to the views of, as I said, the World Health Organization at JA12, the International Commission on Non-Ionizing Radiation Protection, the National Toxicology Program scientists themselves said don't rely on this rat study and extrapolate to humans.
Now, I'd like to point out that the World Health Organization EMF project, which the FCC counsel Ashley Boisel is referring to, is actually, according to a published article that is in the FCC record, an entity with long-standing conflicts of interest. And Dr. Leonard Hardell's paper on the World Health Organization called A Hard Nut to Crack documents how the fact sheets that the World Health Organization has online have, I would say, less than transparent origins. And at Environmental Health Trust, we actually have been writing the World Health Organization EMF project, and we have been asking for information as to who wrote the fact sheets, what they are based on, and so forth, because these fact sheets downplay, whitewash the actual body of evidence on electromagnetic radiation, and they're used the world over as proof of safety, when in fact what we know is that the staff at the World Health Organization EMF project is actually one engineer without a medical background, and she refuses to answer our questions, try as we might, simply to know who wrote the fact sheets and how they were written. What was the process by which they were written?
In 2011, the Cancer Institute of World Health Organization, with the help of 31 experts from all around the world, classified radiofrequency radiation, including mobile phone radiation, as possibly carcinogenic. And 3 weeks later, it was very strange because the World Health Organization headquarters issued a fact sheet that dismissed the cancer risks and the cancer classification.
Whilst the IARC classification covers all radio frequencies, fact sheet 193 only refers to mobile phones. This creates the impression that the classification does not apply to other uses of radio frequencies, such as masts, Wi-Fi, DECT phones, radars, and industrial uses. But the sentence, "To date, no adverse health effects have been established as being caused by mobile phone use," fails to reflect the accumulating body of evidence. This WHO wording is strangely reminiscent of the discourse of the manufacturers who demand the highest level of scientific evidence.
And the very fact that you can interpret this sentence as contradictory, that means that it's not very clear, it is even a bit misleading. So we asked the WHO in Geneva to correct that part of the fact sheet.
Soit corrigé dans leur fact sheet. Mais malheureusement,
but unfortunately, I've checked, the sentence is still there.
This key sentence has enabled manufacturers to deliver a message downplaying the IARC classification, which actually recognizes some tentative evidence for the increase in cancers due to exposure to radio frequencies.
I wanted to know, I asked the responsible person at the World Health Organization, Emily van Deventer, who were the experts that wrote this fact sheet, this new information that was contradicting the Cancer Institute classification, and I had no answer.
Emily van Deventer is the current head of the EMF project within the World Health Organization. In June 2006, she replaced Michael Repaccioli, who she had assisted since the year 2000.
So when I met Emily van Deventer in Brussels 5 months later, I confronted her with my email and I said I didn't never get any reply to my question, and I repeated my question. Who are the experts that you consulted and helped you write this fact sheet? And she still refused to answer to this very simple question. Who are the experts?
This one was just updated.
Yes, but who wrote it?
I am in charge of the fact sheet.
You wrote
and
it?
that the sentences that
They're updated
and then
with
it is a corporate fact sheet. It is not my fact sheet.
Yes, but who wrote it?
Who changed the sentence?
Yes, was it you or did you consult external
I changed
experts?
the sentence. I consulted with a number of experts.
Who were they?
And I
Yes.
had to ask my administration if that is an acceptable question.
Emily van Deventer has no specialist knowledge in the field of health. She is an electrical engineer with expertise in electromagnetic fields. She is a member of the IEEE, the Institute of Electrical and Electronics Engineers, which originally set the international standards for public exposure to mobile phones. Emily van Deventer was a lecturer in the Electrical and Computer Engineering Department of the University of Toronto in Canada. Here she carried out research financed by the telecommunications companies Bell Canada and Nortel before joining the WHO. During her public health role, Emily van Deventer remained in close contact with scientists who work for the industry. She co-wrote an article questioning the principle of precaution with some vocal defenders of the interests of electricity companies. In 2006, she joined Michael Repaccioli and Peter Valberg from the product defense consultancy Gradient in signing an article supporting the theory that electromagnetic waves pose no danger to the public.
So we don't know for sure. We don't know how these cases are going to go, but we were quite impressed, and we believe that the judges really read our briefs. And they also unpacked the reality, which I didn't even mention on this call because there's so much about this issue, which is that the Environmental Protection Agency was defunded. Actually, one of the reasons they haven't done anything is they were defunded in 1996 when they were creating safety limits.